We have a very challenging case today. We have a woman with seizure disorder, multiple sclerosis, and multiple previous surgeries. She had a previous 4 or 5 interbody fusion. That's fused, the hardware was taken out, and she developed adjacent level degeneration, and she underwent a 5-1 open TLIF. Unfortunately, this did not heal, and she also now has adjacent level degeneration at the level above her fusions at 3-4. You can see on the CT scan that there's no fusion mass, there's vacuum phenomenon. The screws are broken at S1 right here, right where it enters the vertebral body, both of them I believe, but we'll find out. And there's an interbody graft there. So we will treat this patient utilizing a bilateral MIS-TLIF approach. And I'll just put in bone graft here and here and keep this cage in as a structural support. I have to redirect all the screws, and if I cannot get a tract into S1 because of these broken remnants of the screws, then I'll just go into the pelvis. But with navigation, I should be able to get into S1, but we'll see. And we'll also treat the adjacent level at L3-4 using a lateral technique, so I can put in a very large implant, and we'll do an indirect decompression. So stage 1 lateral, stage 2 L5-S1 pseudarthrosis repair via bilateral MIS-TLIF approach, and L3 to S1 or pelvis instrumented reconstruction. This will take me most of the day, and hopefully she'll still be ready to go home tomorrow. She's a challenging patient, but we're all rooting for her and hoping she can get back to her life as soon as possible. It's so hard to cut that thing. Isn't that amazing? How did you cut it? Like, you broke it?
These guts right here. That's so cute.
We tried breaking that once, and I'm like, oh my God, you got to saw it off. She's got a really narrow ASIS. Just want to make sure that I am where I think I am. I think it's kind of. Thank you, my man. The fuck just happened there?
Make sure the balls, check the balls.
You know what I think about wrong level surgery, don't you? My wrong level surgery. It's like there's no excuse for wrong level surgery. I'm just sorry. That's why I'm kind of freaking out right now, making sure we got the right level. Oh, sorry. Very deep. But that's where MIS really shines, because if this was done open, I'd have to make the incision twice as long. This is the part, and I try this at home.
Yeah. I'm not trying any of it.
Need that back for the other corner. Putting in the implant now. I think you're going to feel an inch taller. This disc was so discombobulated, I think you're going to notice a big difference. Even right when you wake up, but we'll see. But I'm very optimistic. Now these 2 seconds. It's okay. Shot. This is when you can really see the end plate. Yep. Closing the 1-inch wound. I guess it's more like 1.5 inches. Suture says to Jen. It's in the sacroiliac joint, which is great because if I put in a pelvic screw, I won't have to remove that. No, but it's right in my way. Could also do a S2 screw. We'll see. Hopefully I won't even have to do that.
You got plenty of booty, maybe an S2 would probably.
I know. Thank you. Taking out the hardware. Nut driver.
Thank you, monsieur. Mallet. Just a little bit of play. Luckily, the knuckle. Okay, mallet. Okay, so tap that as I turn it. Ready, go.
Keep going.
Mm-hmm. Mm-hmm. You got to keep
Sorry,
hitting
your
it.
knuckles are, I'm afraid I'm going to hit your knuckles.
Yep. Nerves are working. Well, I got more work to do. It's going well. Well, I just got a little bit more contouring. I hope you get better because I am working like a dog here. Boo-hoo, poor Dr. Kim. Keep going. Yeah. Come on in with fluoro.
All right, here is the video, the radiographic summary of the surgery. This is the first half, the lateral. I have that lateral cage that's going to expand. Here comes the interbody erection. I like that position. I've got the screws in now. That's the side view. Side view. That's the L5S1 bilateral T-lift with repair. Another interbody erection. Look at that thing. I have two of them. That's the final construct in the frontal view. It's called AP. That's the final construct in the side view called the lateral. The surgery went beautifully. I was able to use all the same screw tracks, so I didn't have to go to the pelvis. And I skirted along the side right next to the broken screws at S1. The L5 screw holes were really rock solid, and then I put in perfect screws into L3. And I think you're going to feel a lot better, feel a lot taller, and be able to stand upright a lot better. So best wishes on a speedy and robust recovery. We're all rooting for you.